Well, once again, good evening, everybody, and welcome to our monthly webinar series. This webinar is something that we do very often, at least once in a month, focusing on different regions. We try to bring you a lot of valuable information, generally from healthcare industry, and we also try to give you more information on admissions to, of course, to Texila Medical Education Program. At the same time, give you a little bit more insight on licensing in US and opportunities for a medical graduate to practice in the US. These are some of the key topics that we cover as a part of our presentation. So I think we have almost around 20 attendees now. With that, I guess we can get started. Again, my name is Shyam Kumar. I'm the CEO of Texila American University. I am assuming most of you are based out of India, and this event is mostly focused for our participants from India. I am actually based out of Guyana. I am currently at the campus Texila American University campus in Guyana, but we have an office in Dallas, Texas, where I'm primarily based. So as I was informing at the beginning, this is something that we do every month. We try to bring in new information. One of our last presentations were focused on global opportunities in healthcare and how to practice and licensability in US and also in India. That was our previous topic that we discussed. Today, we are going to talk about AI in medicine. When I say AI, artificial intelligence in medicine. It's a very interesting topic. We will quickly walk through the key aspects of AI in medicine, and then I would take a few minutes after that to focus on some of the key aspects of our Texila American University Medical Education Program. And with that, if you have any questions, I'll be more than happy to answer it for you. Now, when we talk about today's topic, that AI in medicine, I'm going to share my brief presentation. But before we do that, if any of you have not used ChatGPT or Gemini from Google, check it out. Okay, try it out. I am assuming some of you at least would have used it. It is a very early stage of artificial intelligence related information sharing platform. To give you one example, if you want, I'm just taking one random example and try to relate it to healthcare. If you are prescribed a medicine by a doctor, let's say you have some kind of bacterial infection, and your doctor has prescribed you azithromycin as an antibiotic. You can easily go to ChatGPT or Google Gemini and test on what is the side effects of this medicine. Any information that you want about this medicine, you can just type it in. It will give you a whole host of information. So check it out. It's a good tool that you can learn yourself. Again, very early stages of how AI can support you with a lot of information that you traditionally would not have access to. So ChatGPT or Gemini, again, that is only one example, but all for other activities, other information that you require, it's a great tool and gives you a lot of information from different parts of the world. With that said, I'm sharing my screen. Please let me know if it is visible. Again, technology in medicine, how artificial intelligence and technology are changing the medical landscape. This is the key point. Again, we are looking at it more from a very basic standpoint. I'm not going into too much of details of how AI is revolutionizing the world today, especially in the healthcare field. But we'll talk about some key points for this topic. Okay, these are the topics that we will cover as a part of this discussion. History of technology in healthcare, the evolution, and it's a very interesting, I would say 100 years or so, where technology has come into place and how some of the changes in the industry has revolutionized medicine in general. So we'll talk about some of the key aspects or key milestones of technology or revolutionizing healthcare. We'll talk about a little bit more on AI and technology in medicine, how some of these advancements are changing the field of medicine, and giving open you for some of the challenges and thoughts that even AI is offering you currently, some of the threats and how it can change and how it can impact some of our daily life. This is what we're going to talk about in this slide, around 6 to 7 slides and probably 20 minutes of presentation. Moving on with that, this is actually the history of technology in healthcare and medicine. We invented microscopes in the 17th century. Until then, looking at microorganisms and figuring out how these look and how can we mitigate some of the challenges threat generated by this bacteria was all not known to human being. So microscope is something that that reinvented or revolutionized the way we look at things, especially at microorganisms level. Smallpox vaccine, it was smallpox. If some of you have read about it, at least learned about it in your early school education time, was a major threat to human race at that point of time. A vaccine for smallpox was a major discovery that started the disease prevention process. Anesthesia advancement in surgical procedure. Imagine the time when there was no anesthesia, by which somebody has to be in full senses with full pain when a surgical procedure was done. As you know, surgical procedures was happening even early years. So people used to live through the pain when any procedures was done. So anesthesia was another advancement that changed the whole landscape. In 1928, Alexander Fleming invented penicillin. Now, penicillin is what kick-started the whole era of antibiotics. Any antibiotics that you have access to now is the research and the process of antibiotic generation has started from penicillin. Now, every time you go, you have a problem. The first thing that comes to my mind is antibiotics that is prescribed. Nowadays, I think you walk into a medical store, they will even give you antibiotic on the counter, without even consulting a doctor. So that is how the antibiotic use is now, but it all started from invention of penicillin. Again, X-ray, another key finding. Before that, we could not see if I had a fracture in my hand, I would go to a local doctor who would say, okay, looks like you have a problem, and let's fix it. But now visibility is much higher. From X-ray, you can see if something is wrong. Then blood transfusions, organ transplantation, this all came into picture. Blood transfusion is a key aspect now, because you would see and hear about blood donations. We have all donated at some point in our life, might have donated blood to people. Imagine what kind of technology that is, where we are taking live blood cells from my body to your body or somebody else's body. So that is another revolution that has changed the healthcare landscape. Then came in the 1970s, we knew about CT scans or computerized tomography and MRI, which gives us more of a visual imaging of internal organs and internal part of a body. Again, making people and physicians able to make proper decisions with factual information. So no guesswork anymore. And then now in the current era is more on robotics, AI, and telemedicine. This is what we're going to talk about mostly: robotics, AI, and telemedicine, how these are changing transforming the healthcare delivery. Now, AI in diagnostics, going back to one example that I shared, where if you type in a requirement to Chat GPT, being a very simple form of AI generated information sharing platform, in seconds, it will give you information. Now, imagine this kind of a system or a tool that is already in place where physicians and doctors have access to thousands and thousands of information, thousands and thousands of data based on AI platforms. Because keep in mind, when you enter your information data into somebody's raising a hand. I think we will keep questions for the end of the session, please. Okay. So when you one more question is there. Okay, just so you know, we'll leave our Q&A for towards the end of the session. Okay, imagine a situation where by which you walk into your doctor's office, you give in your vitals, you talk about your challenges. Doctor can log in and explore all related information relating to a similar type of information about you. Imagine that kind of situation. So AI has captured a lot of data. It's a tool for people to make data-driven decision making, which traditionally you would have to research thousands and thousands of hours to get information, but AI will give you this information in one shot, in 1 minute. So this allows for earlier and more accurate diagnosis of diseases. AI-powered tools can also personalize treatment plans based on individual patient data. So now, even for doctors nowadays, I'm sure you can imagine a situation where you go and, again, very primitive sense of what we're looking at. You go to a doctor, the doctor prescribes you a blood work or blood test. You go to the clinic, give the information, then you take a printout, bring it to the doctor, and doctor looks at the data. Now, imagine a situation where doctor has thousands of data or information on this kind of scenarios to be compared when you are presenting your information. That helps them to make educated decision. It helps in making a lot more research, comparison of health scenarios from different parts of the world. Again, it paves for further inventions and interventions in the field of medicine. That is one of the key aspects that AI is capable of. You might have heard about robotic surgery. Now, robotic surgery, to me, it's more at a very basic level at this point. There are advanced robotic surgery happening, but that is not very common currently. Now, robotic surgery currently happens mostly at the minimally invasive procedures. Minimally invasive procedures means, small cuts in your body where simple things have to be done. So what generally happens is, when such a micro cuts and any small procedures have to be made, doing that with human hand becomes very complicated. Whereas AI or a robot will be able to do that with much more accuracy. Even though a physician is controlling it remotely, but accuracy level is much higher. Number one. Okay. Number two, anything that AI or robot does, it has a camera embedded in it. So it gives you a much more visibility of human organs inside. So, for example, earlier a doctor would have to do a surgery on me, cut open my entire part and see what is inside and do it. But the same thing can be done by a small cut where a camera is inserted and it gives the doctor a full visibility and the equipment is inserted and he can do the surgery. So now imagine how it has changed. Recovery is faster, chances of further risk is minimized. Imagine you have a bigger cut, bacteria, infections, it's all, there are much more possibilities. But with this intervention of robotic surgery, this is completely eradicated or minimized to a large extent. So robots can also perform complex surgeries, but I think it is not still not hugely prevailing in different parts of the world. It one of the main factors. I myself had my knee surgery many years ago, which was not a robotic surgery. Normally, it would have taken me around 2 months to recover, and with huge pain, I recovered in hardly 3 weeks, and I have a simple dot in my knee right now that shows that even reflects that yes, I had a surgery. That's how powerful this robotic surgery is. Even though it sounds robotic surgery, in many occasions it is used very commonly now. Even for simple knee surgeries, they put small insertions, put camera, look at what is inside, what is the problem, and if something has to be removed, it is removed that way. Even your knee replacement surgery is now done using robotic opportunities. This is a no-brainer. I don't have to explain much about it. Wearable tech, monitoring your health condition on the go. Again, giving access to a lot of information, a lot of data. Your Apple Watch can now even give you your EKG or ECG information. So your watch is tracking your health conditions on a daily basis. So if it is seeing any challenges, if it is seeing any issues, it triggers you. Look at this. Your heart rate is very much more than normal in the last 1 week. Something is wrong. See, now you are able to make a decision. Okay, well, should I consult a doctor? Is something wrong with me? Your EKG, I can run my EKG from my or ECG from my watch anytime I want. I plug in, I see what is wrong. And again, it captures the data 3, 4 times. 1 week I do it. If something is wrong, it will trigger me. Even my watch, when I'm doing my exercise, it will send me a message. Your heartbeat is abnormally high. It's at 170, 130, whatever it is. Now, it's all possible through AI. Imagine normally we would assume that, okay, I have slight tiredness, slight fatigue. Okay, I'll stay home. I'll see what happens. And when there's an acute situation, acute condition, we will go to a doctor. But with this kind of technology, wearable technology, it gives you live data, live information, whereby you are able to make the right decision for yourself. Okay, I'm seeing something is wrong with my heartbeat in the last few days, 1 week. I need to get some expert help. Now, this data is available for you and to identify health risk and even prevent diseases. What it does is it gives you control of your own health situation, at least more or less. And most of these issues, you can handle it yourself. There are new technologies that come in, which will eventually give you blood sugar level also. So in new watches that are coming in, that will give, and it is an ongoing progress. So basically, with this technology, you are able to keep a good handle on your own health condition. Telemedicine, it's getting very common, very prominent in at least in the US and the mostly developed countries. I myself, as I told you, I'm currently in Guyana, but I live mostly in the US. Last week I had a meeting with my doctor on my vitals and so on. I did my blood work before I left the country. Now I can talk to my doctor, talk about any issues and challenges that I have, and he can prescribe my medication to the pharmacy, and I can go and pick it up if it is needed. Now the advantages, it makes it more accessible to people from different parts of the world. Even in US, there are remote areas where there are not too many hospitals. But so for those people, AI and telemedicine related opportunities are a key source. It is very well prevalent in mostly behavioral health related issues and challenges. Telehealth and even family practice telehealth is required. Now, in the US currently, and this was hugely prevalent during the pandemic time and post pandemic, if you have an issue, you can always call your. There is a bunch of telemedicine doctors that are available whom you can call. They'll come online. They have a system. You talk about a problem, based on it, they'll prescribe you medication. And mostly for situations where vital signs taking are not required. Okay, so it is getting very prevalent. Follow-up visits are very common in telemedicine, and mental health consultations are very common in telemedicine related systems. Again, AI is growing. It's an extremely growing field. There are further researches that is happening in AI. It can analyze a lot of data sets and help researchers come up with targets for therapies and preparing drugs. It can accelerate drug discovery process. Imagine, pandemic is a classic example where, the testing of some of the drugs were done on people. And if AI was not there to analyze and interpret and give you factual data within seconds and seconds or minutes, coming up with this vaccine in such a short span of time would not have been possible. So analyzing data and giving feedback, giving report, and giving different combinations is made possible because of the invention of AI. Now, AI can also personalize medicine by tailoring treatments to individuals, patients, and genetic makeup. Summarizing some of the benefits of AI in healthcare: improved accuracy and efficiency in diagnosis treatment, personalized medicine tailored to individual needs, early detection and prevention. We talked about it. Wearables will help you early identify if you have problems. Enhance accessibility and convenience for patients. Telemedicine is a classic example. Reduce healthcare costs in the long run, and that is another example. It will, you might not see this highly in India, but in the US, healthcare is probably one of the most expensive field. So going and visiting a doctor, going and to a hospital is all extremely expensive. To give you one example, if I am going to emergency medicine for a simple problem that I face, it is going to cost me at least Indian rupees 50,000 rupees minimum for a half an hour. I go, nothing is wrong. I come back, and that is what we're looking at. So it's expensive. So over a period of time, with the invent of AI, these things could be mitigated, at least save time. Help you make your own right decision and save time, and thereby reducing the cost and making it accessible. Some of the challenges and considerations: ethical concerns, a big concern for AI, because AI's boundary is still not fully defined, which means a lot of people can have access to your information, which is unethical, and they can use that information for further research, again, without your permission, again, unethical. So that is one consideration that we have to keep in mind for AI. AI-powered technologies are very expensive. So even a lot of things currently, even in the US also, it is not accessible to all the hospitals. So it is very expensive. Many systems will not have access to it. It will take years and years for it to come into play and be given to a normal healthcare setup. The most important challenge that AI currently is facing is uh, training and people's understanding of AI and the usage of it. So that is one vulnerability that AI poses. People will take more years and years, especially the baby boomers will take many more years to get used to the AI system, AI technology. So that is another challenge. And as always, this cannot be fully done without human intervention. So human intervention has to be there, at least as of now. No AI functions perfectly in autopilot. Human intervention has to be there, which is the safest way of utilizing AI for any further enhancements. So these are some of the challenges and consideration that we have to keep in mind. You as future healthcare leaders, future healthcare learners, this is something that you have to keep in mind while you venture upon some of these aspects. This is my brief presentation about AI. I will I will go to my next presentation quickly, which talks mostly about Texilla, and then I think I can take the questions. I hope that's okay with you all. Some of you might already know this, so I will skip some slides. I don't want to make this presentation very long, only touching upon the key aspects. Again, you guys have heard about Texilla American University. We are a medical education system, medical university, medical school based out of Guyana in South America. It is a English-speaking country in South America, very one of the fastest developing countries in the world now, based in very close to Brazil. It is on the part of South America, which is part of the mainland, but we come under the Caribbean system. If any of you follow cricket, Guyana has produced a lot of famous cricket players. For example, Ram Naresh Sharma, Shivnarayan Chandrapur. There are a lot of players who are from Guyana. So we are a part of West Indies for cricket. That is where Texilla is located. Some of the key aspects of Texilla. Why should somebody even think about Texilla as an opportunity for higher education? We are one of the very few schools in the region that is accredited by two accrediting agencies, ACCMA and CAMHP. These are the only two agencies in this region accrediting Caribbean medical, authorized agencies in this region accrediting Caribbean medical schools, and we are accredited by both of these accrediting agencies. We have a clinical campus based out of US in Tucson, Arizona. Again, I'm not going to go too much of details in the interest of saving time, so that I would answer the questions towards the end. Some of these you might already know. Okay, we have a good pass rate in USMLE, which I'll go into details. We have one of the best campuses in the region. I have actually been to. Somebody has raised with Vidyushi Kunwar raised hand. We'll keep questions towards the end, Vidyushi. Okay, and we'll give enough time for everyone to ask questions. So we have one of the best campuses in the region. I myself have been to almost all the campuses in the Caribbean region. We have a beautiful campus, well equipped. Again, I'll show you some photos of the campus. Most of you would have seen videos that are shared by your admissions team member. That videos are shot at our campus in Guyana. Affordable tuition. When I say affordable tuition, of all the accredited schools in the Caribbean region, we are by far the most affordable, and I can challenge anybody on that. We are by far the most affordable program in the Caribbean region of all the accredited schools. Now, why accredited? We'll talk about that in the next slides. Hospital-based training. We work with GPHC. It's a local hospital. It's a 650-bed teaching hospital. Students have access to patients from the world very early stages. They work with doctors from GPHC. So our basic science program itself is tailored for hospital-based training. We are ranked as the best medical school in Guyana by Uni ranking. Low student to faculty ratio. We have a 1:8 student to faculty ratio. And a few other points I think we will cover in some of our upcoming slides in the interest of making this pretty fast for all of you to save time for questions towards the end. We have a 94% pass rate in USMLE Step 1. This is for 2023. 90% pass rate in USMLE Step 2. We have an 80% USMLE residency placement rate and 96% student retention rate. And this is very important. Why is it that we have a 96% student retention rate? Most of the students who enroll in Texila, 96% of them stay with us and graduate, which means there are no students, hardly any students who transfer to other schools from Texila because they're happy and satisfied with what we offer. Key accreditations, ACCM and CAMHP. One thing that I always tell students, whether you're joining Texila or not Texila, don't even think about any school without accreditation. You will have troubles in the future. If you're enrolling in a medical education program, verify the credentials. You should have accreditation today, not tomorrow, not after tomorrow, not next year, not next month. Absolutely no. Don't even think about any school without accreditation from the Caribbean region. And we are accredited by 2 agencies, which are the primary accrediting agencies for the Caribbean region. We are truly international, and this is something that we are very proud of. We call ourselves a truly international school. One of our key pillars is to improve on our diversity. We have students from 45 different countries, 45 different nationalities. At any given time on the campus in the medical education program, we have students from at least 30 countries all the time. So till date, including our enrollments and graduation students, we have had students from 42 different countries. Now, this gets very exciting as we move on, because we have this event every semester on campus called Multicultural Night or Multicultural Evening, where we invite students to celebrate one day full of their culture. We have a section for Indian students, African students, Guyanese students, Caribbean students, where they present their, their unique dressing style, their food, their music. So it's a vibrant atmosphere. It's a fun-loving, vibrant environment that we try to create for students, and we want students to interact, mingle, know the culture. This is a medical education program, but end of the day, we are also looking at making you better human beings, better individuals who can coexist with people from different parts of the world. And this is a great opportunity. Program structure, many of you would already know. I will quickly go through the program structure. We have advanced science subject courses, which is also called pre-med in many places. It is covered for 1 year, 2 semesters of pre-med program or advanced science program. After that, you have 4 semesters of basic science program. Basic science mostly focuses on your basic, or let's call it the theory part of medicine, which is your anatomy, physiology, biochemistry, and so on and so on. And then we have a transition semester, which is bridging your gap between basic science and clinical, where you will have your review program and also your introduction to clinical medicine, which is exposing you more towards clinical education. Then we have 4 semesters of clinical education, which can either be done in US or Guyana. We are one of the only private schools in the Caribbean region which is doing our clinical training at a teaching hospital locally. That is one challenge that you might face eventually. If some of you, or if your friends are in other schools, they might have already told you, "Oh, I have a problem in getting my rotations, my clinical training." because many of these other Caribbean countries they don't have big hospital to give you proper clinical exposure. And Guyana has that opportunity. It's a 650-bed teaching hospital that we have in Guyana, plus Tucson Medical Center. Tucson Medical Center is the largest hospital in Arizona. This is the program structure in brief. Again, I'll be taking more questions as we move on. I'm not going to cover the application process. I think we talked about it, most of it, or your admission. EAs would have already, the photo that we see here is our campus. Again, as I mentioned, it's a beautiful campus. We are located in a place called Providence in Guyana, one of the most serene and beautiful and safest place to live in Guyana at this point. These are all real photos of our labs and so on with students in different lab setting. Some more photos, what you see here towards the left-hand side is as soon as you walk in, this is our main entry area of the campus. The library, you can see the library on the top. Towards the right, you can see our lab. And on the third floor of the building, we have a health center, a fitness center, and a students' lounge. Where we have pool table, table tennis, and some other recreation facilities, and of course, along with more reading space. This is one slide that I want to cover, which I am personally quite passionate about. Some of the supplemental resources that we offer students. And I want you to understand that, these systems are all offered to students as a part of the medical education program. First one is Lecturio. Now, Lecturio is a program that is given to students where you have access to thousands and thousands of medical related video lectures online. While Lecturio, we do have classes from 8 to 3. Okay, don't get me wrong. We have classes from 8 to 3. We have our faculty members every day taking classes. But Lecturio will help you supplement your learning more and more. For example, you had a session on head and neck today morning in your anatomy class. Now, you have some concerns. What would you normally do? You can, of course, meet with your faculty, your teacher, go and ask, clarify, talk to one of your friends and clarify. But with Lecturio, you can type in the same topic and you can see a video lecture taken by some of the most eminent faculties from the US. So each and every topic, medical education topic, has a video in Lecturio supported by multimedia presentation. So this helps you in learning, recouping and recapping on whatever you have learned from your class. So it's a great supplemental learning tool for students. It has USMLE review questions. It has smart recall questions. What I mean by smart recall is after one video session is done, to reiterate on your learning, it'll ask you around 4 or 5 questions, to reinforce your learning in that specific topic. That is also embedded in Lecturio. Then learning paths is, it can help you create your own learning plan. This is my semester. I want to week 1, week 2, week 3, week 4. This is what I as a student want to cover. You can create that in Lecturio system. Okay, week 1, these are the 5 topics I should learn. Week 2, this is what I should learn. Pace yourself in a learning management system. And that is what Lecturio also gives you in creating your own learning paths and managing it properly. Then is Kaplan. Many of you might have heard about it. Some of you might not have heard about it. Kaplan is a key or the largest USMLE review program. If you don't know about USMLE or have not heard much about USMLE, USMLE is United States Medical Licensing Exam. It is an exam required for your exam to be cleared for you to eventually practice medicine in the US. So USMLE, we provide as a part of our program, we provide training for USMLE so that you are properly prepared for eventually getting into licensing in the US and eventually getting into a residency program in the US. So Kaplan, we have partnered with Kaplan to offer the USMLE review program for our students. LIRN and Springer. These are ebooks and e-journals. We have around 200,000 ebooks, which means, gone are those days where you would carry all the books in your hand and go to campus. You can log in from wherever you are and access your books and download. You can even see it online. If your internet bandwidth is not that great, you can download the books in PDF versions and use it for your convenience. So that is also something that we are providing as a part of our learning resources, learning opportunities. Cyber Patient, it's very interesting. One of these days, I would like to take a session on Cyber Patient for the students. It is a virtual hospital or a patient simulator. So what it means is it will be a patient lying down. It is a part of your transition semester. As how you learn to interact with patients, you can virtually interact with the patient in the system itself. It can generate cases, you can generate cough, fever, all kinds of scenarios. You can take the vital signs, you can take the blood pressure. But anyway, on a virtual environment, this is not supplementing your clinical training. this is given to you during the basic sense so that you get more exposed to your clinical knowledge or help you more in gearing towards your clinical education experience. Okay, lastly, NBME, which is to me is the most important of all these things. NBME, or National Board of Medical Examiners, as the same board that conducts USMLE examinations in the US. Now, NBME also offers a service to medical schools, which is if you are a medical school in US, NBME will give you NBME exams, which are USMLE oriented, USMLE modeled exams as a final examination of a subject. For example, if I'm taking anatomy as a subject in my MD1, taking as an example, my final exam of anatomy can be given by NBME. Now, what's the advantage? From day one onwards, first semester onwards, students are exposed to USMLE-oriented questions, USMLE-oriented pathways. Now, we as Texila have subscribed to NBME, which some schools in Caribbean do. And we have subscribed to NBME as all our final examinations, which means all the examinations, final exams that you take are NBME examinations. End of your basic science program, which is a theory part of medical education, you take an exit exam, which is exactly mimicking the USMLE pathway. You take an NBME comprehensive exit exam. And after clinical, you take another exit exam, which is NBME clinical exit exam. So all the core subjects, we are using NBME as a tool to test your knowledge, and we are preparing you towards NBME exam. And final exam is done by NBME. In between, you have around 3 or 4 internal exam based on the subject. And those are all USMLE oriented, NBME oriented exam questions. Again, we talked about our cultural diversity. Some photos that you can see, what you see on the right-hand side is backside of a campus where we have a soccer field, we have a volleyball field, and adequate space for student recreation. On the left middle that you see here is Pinktober. We do celebrate World Health calendar, where we have events organized on campus to promote awareness on health and health education. So Pinktober we were trying to create awareness on breast cancer. So we did an event on campus. We did a walk in the areas. When I say we, I mean to say our students and faculty. On the top that you see is one of our health clinics. We conduct health clinics in different parts of Guyana. In small regions, we take around 20, 30 students. We set up a clinic and support the patients in the region. And it also helps our students to understand the basics of simple things, interacting with patients, knowing the patients more. How can you work with the patient at that level? Okay, so this is a photo of a health clinic that we have done, and same on the right-hand side. Accommodation facilities around the campus. These are quite easily accessible. We provide accommodations to mandatory. You have to live in our hostel for the first semester. After that, if you want to continue, you can. Otherwise, you can live outside. These are all these apartments that I'm showing you is within the around 5 to 10 minutes away from campus. Most students use some of these apartments. A short about Guyana, fastest growing economy in the world now. If you do a simple Google search, Guyana is the fastest growing economy in the world now. It is growing because of huge oil reserves in Guyana. We have been producing oil since 2009. And then the remaining slides focus a little bit more on Guyana. So I think in the interest of saving time, I've already covered almost 40 minutes of the presentation. I will save time now for questions. Ramya Srinivas is asking about fee structure. I think your EAs or admission team members will reach out to you with tuition information. So I think if Murli is on this call or others, admission support team in this call, they will provide you more information on fee structure and so on. Amit has raised his hand. Amit, I've given you access to talk. You can unmute yourself and ask a question, please.
Hello, sir. Good evening.
Good evening, Amit. How are you?
I'm good, sir. I'm good. So actually, I'm a transfer student, sir. So I want to ask about the time period of the transition semester. Just you talked like after basic science.
So the whole transition semester, including the time that you would take CBSE exam, Amit, comes around
Yes.
6 months.
So and how much I need to get in like CBS exam before giving the USMLE?
You have to give CBSE exam before giving USMLE.
Yeah, like, but how many marks, like what percentage? 70, 75?
For you to take USMLE, you have to score 65 in CBSE, 65%.
And like what will happen in these 6 months? Like online classes daily and like for
We have
6
classes
months?
on campus. The Kaplan review program. So the transition semester has 2 pieces. Okay, one is your USMLE review program, which is we work with Kaplan, which is facilitated by our own faculty on campus. And afternoons focus on ICM, Introduction to Clinical Medicine, which is essentially a little bit more advanced of your physical diagnosis classes and so on. taught by clinical faculty from the hospital. So essentially orienting you towards your clinical rotations eventually. And this is the time when
Uh,
we are offering you the cyber patient.
okay. Sir, like in the last school where I was in, we did like ICM. I did ICM in the last semester.
Okay.
So do I need to come to campus, or just it can be done from here, like online from here in
See,
India?
Amit, specific information we can only give after our admissions team members, admissions committee
Okay.
see your transcript. Okay.
Okay.
So those
Okay.
are all transcript related questions, right? So
Okay.
I cannot
Okay.
give you specific information on that. That we can have a one-on-one discussion if needed, or you can talk to your admissions team member, give your transcript, they will get it evaluated and they'll come back to you.
Yeah, yeah, yeah. Okay. Thank you, sir.
Thank you, Amit. Taking long to come to us for medical, is it worth it? Well, if you ask me, my personal opinion, education is absolutely worth it. Whether it is medicine, whether it is business, whether it is engineering, if you can afford it, definitely go for it. Any education. Now, medicine is depending on your choice. If you believe medicine is the right place for you to study, 100% it is worth it. So I'm not going to comment on is taking a loan for studying medicine, is it worth it? I wouldn't know, because that is your personal preference. But with that said, education is worth any money that you spend. So if medicine is the field that of interest to you, absolutely yes. Other Caribbean colleges also offer Kaplan review course. So how is it different? How is it different the way Texila offers? Good question. Okay, good question. Somebody's asking what is salary after MD. Okay, anyway, so Kaplan, so there are two ways in which Kaplan review can happen. Okay, one, you can do it live prep, which is you can go to a Kaplan center in the US, attend classes from morning till evening. They do a 1 month or 2 months of live prep Kaplan. That is option number one. Now, option number two is Kaplan gives you all these online resources with even live training and teaching on that. So how we do our Kaplan learning is we facilitate with a faculty, whereby we have dedicated sessions and topics that are offered during transition semester. We will play the video of Kaplan, and we have faculty on campus, on the facility, in the same room that you are, where the topics that are covered will be discussed. So even though we use resources of Kaplan as a material for your ICM or your transition semester, our faculty support and facilitate Kaplan review or Kaplan discussions. And end of the Kaplan program is when you take your USMLE CBSE. So is it different from other schools? I don't know how some of these other schools do. I know there are schools who do live prep. I also know there are schools that does fully online, which means there's no faculty intervention. They do give the resources and you are supposed to take and learn Kaplan on your own. So I cannot comment on other schools, but this is how we do our Kaplan training. Can we still go to the US if we continue rotations in Guyana? Yes, you can go to US if you continue rotations in Guyana, but I am assuming I understand a question right. So if you are doing a full rotation in Guyana, why should you go to US? I mean, to visit, yes, then you don't have to enroll in the medical education program. But if you want to do at least maybe 2 or 3 electives in your education program, and if you want to do that, yes, you can definitely go to US. So let's say you complete all your core in Guyana and want to do some of your electives in US, that is an option. But other than that, going to US for no reason is not something that we promote. What is the salary after MD and post graduation? Under 18 can go for it. Good question. I can give you an example of US. So if you're doing residency in the US, let us assume that you as a student matched into a residency program in the US. Okay. Residency program is essentially your postgraduate training or postgraduate medical training. And you might be in your family medicine, internal medicine, any rotation, any of the residency program that you opted for, or surgery for that matter. While you are in rotations, or while you are in residency, sorry, you are paid a salary. So if it's a family medicine residency, it runs for 3 years. During these 3 years, you are offered a salary of anywhere from $53,000 to around $60,000 per year, depending on the location, depending on where you are doing your residency. So while you are doing residency, while you are doing your residency in the US, you get salary, you get paid, number one. Now, once you are finished your residency, let us say family medicine, after 3 years, you can start your starting salary could be anywhere from $120,000, $150,000 all the way through, depending on your specialization. For example, if it's a surgeon, if it's a neurosurgeon and so on, it can go up to $250,000 or $250,000 per year and so on. So that is giving you a good sense. Under 18 can go for it. Yes, if you're under 18, you can start definitely with our pre-med program. And I guarantee you, by the time you get your residency, you will definitely be more than 18. Can we match in the US if we do rotations in Guyana? See, one thing, there is nothing stopping you from matching in the US if you do rotations in Guyana. But keep in mind, when you submit your application for a US residency, they always prefer or they always welcome students who have a proper exposure to US healthcare system. And that is critically important. So while explicitly there's nothing stopping you from applying for residency or matching into residency if you have done rotations in Guyana, I would say your chances are much higher if you have done your clinical training in the US. Scholarship program, I think I will let the admissions team members give you information on scholarship. Can I prepare for NEET or next? So as a part of our training for the final year, we also give you access to resources and materials for preparing for the next exam also. Does the university have accommodation in Tucson or for clinical rotation students? So we don't have our own accommodation in Tucson, but what our students that are currently there, what we do is when students are ready for Tucson rotation, we match them with students, and we also have a clinical coordinator at Tucson who will help the students with finding the private apartments available. Okay, moving on. Do we get next exam training at Excella? Yes, to 1 year in an MD8, which is a final year of your training program. We do provide next training also. Do we need to complete all the steps exam to residency, or can we get into residency after step 2? Good question. You can get into residency after USMLE step 1 and step 2. Step 3 is not mandatory for residency program. But with that said, most residency program will require you to get your step 3 while you are in residency. Not most, all residency program. Some will require you to get your step 3 at the first year, some in the second year. But while you are in the residency program, you will have to clear USMLE step 3 also. But you can get into residency program with USMLE step 1 and step 2. My admission counselor tell that to me, with you, definitely it's not free. Okay, medical education that we offer is not free. So I'm not sure what your admission counselor mentioned. If he or she mentioned that to you, it is wrong. I will enter to MBBS by this, but what of MS? I think you are referring to postgraduate, residency program in the US. I think our admission counselor will give you more information on that. Okay, I think I've briefly talked about it. Now, if I go and explain the whole residency program in the US, that is another at least half an hour to 1 hour presentation. Could you explain the grading system of MDs, doctor? You have to have a, sir, please tell something about university. I think Munib, in the presentation, I talked quite a bit about Texela, who we are, what we talked about, our accreditation, our credentials, our facilities, and so on. So we covered a lot during that. Okay, if I repeat it all over again, that will not be the interest of others in the session. So you can have a one-on-one with our admissions team member. I think that will be better. If you did not grab what I was saying during the presentation, or if you attended late, and we can also share you videos of this. Okay, I don't want to go and repeat it all over again. Again, it will not be in the best interest of others in the meeting. Harish is asking about grading system. Could you please explain the system of MD, grading system of MD's doctor? We're asking how the program is graded during the MD program. Well, then taking basic science as an example, one subject, again, breaking it down subject by subject. Anatomy, you have around 4 internal exams, which is conducted by Texela, and your final exam is NBME, and your final grade is a combination of your internal exam as well as the NBME exams, and you have to get 70% to obtain a passing score. So 70 is a C, if that's what your question is. Munir Bashir. Munir, sorry about that. Okay, I will have one of our admission counselor reach out to you and give you all the information. Okay, because we only have 5 more minutes. It will not be fair on others if I go back and talk about the entire university as a whole. Okay, sorry about that, but they'll give you information on our program. And if you have any further questions, then I'll be more than happy to connect with you later. Okay, I guess there are no further questions. With that, I want to thank all of you for being a part of this session. As we said, we try to bring in more and more new topics every month. Maybe next time we'll talk about US residency and application process. Again, residency for the postgraduate training program. Or any other topic that is of interest. So if you have attended one event, doesn't mean that you should not attend the next one. Please feel free, attend the next event also, invite your friends or anybody who is interested in knowing more about the education system of US, medical education program, USMLE, and so on and so on, feel free to be part of our sessions. And once again, I thank all of you for being a part of this event. Have a good night, and let us know if you have any questions. Our admission team members will be in touch with you. Okay, so if you have any questions, please feel free.